Landing that dream job, especially, in a demanding field like nursing, can feel like, well, it can feel like navigating a really complex patient case sometimes.
Oh, absolutely.
It's more than just having the right answers ready, isn't it? It's about really showing your skills, your personality, and that genuine passion that drives you.
Hmm.
And let's be honest, that can be a real challenge. Doesn't matter if you're a seasoned pro or just starting out. Yeah.
You've hit the nail on the head. Think of it like preparing for a critical assessment. The interviewer isn't just glancing at your resume. They're trying to see the core of how you approach patient care, teamwork, unexpected challenges, all of it.
Right.
So our goal in this session really is to give you a structured approach to those common nursing interview questions.
Yeah.
We'll focus on the themes underneath them and, how to build responses that don't just answer, but actually leave a lasting impression.
Okay.
We want to pull out those practical strategies that boost your confidence and help you feel genuinely prepared.
Yeah.
IS. The strategic foundation, behavioral questions, and the STAR method.
Okay, so let's unpack that a bit. We hear the term behavioral questions thrown around a lot in nursing interviews, but what are interviewers really trying to get at, beyond just asking for a past example, I mean?
Yeah, that's a great question.
Especially in a field as dynamic as nursing, is it more about the specific action, or is it the thinking behind it?
Well, what's really insightful about behavioral questions is they're less about what you did and much more about how you thought through it, how you adapted, what you learned.
Okay.
Nurses are so hands-on, right? Direct patient care, making sure things run smoothly, collaborating with the whole team. Interviewers, they're less interested in textbook knowledge.
Right, a theory.
Exactly. They want to see real-world application. How do you actually act in those tricky situations?
Yeah.
And crucially, how well can you adapt to the specific vibe and workflow of their unit?
Hmm.
The big themes they keep coming back to are patient care, teamwork, and adaptability. They're looking for evidence of your, let's say, core problem-solving approach, not just clinical facts.
That's a really interesting way to put it, your operational DNA. Makes total sense that past behavior predicts future performance.
Hmm.
And to answer those effectively, there's this framework, people talk about the STAR method. It seems like the gold standard. Can you break that down for us?
Absolutely. The STAR method is incredibly useful. It helps structure your answer into a clear, concise story, like a mini narrative about your experience. It's an acronym.
Okay.
S is for situation. You start by setting the scene. Describe a specific, relevant time you handled something successfully. Don't be vague. Paint a quick picture.
Got it. Situation.
T is for task. Here, you clearly state what your specific job or responsibility was in that situation, what needed to get done.
Task.
A is for action. Now, this is where you really shine. You highlight the specific steps you took, not just what happened generally, but your concrete actions. Show your thinking, your proactivity. Demonstrate it.
Right, the what you did part.
Exactly. And finally, R is for result. What happened because of your actions? How did you contribute to that positive outcome? And maybe most importantly, what did you learn from it all?
Ah, the learning piece.
Yes. And this method works great even for new grads. You can pull from clinicals, projects, even relevant life stuff. It's about showing your process. 2, navigating patient care scenarios.
That's a really solid framework. Makes sense. Let's try putting it into practice. First major theme you mentioned, patient care. A really common question is, tell me about a time you dealt with an unhappy or difficult patient or family member. How do you handle that one carefully in an interview?
Ooh, yeah, that's a delicate one.
Yeah.
It's basically a test of empathy and problem solving, but
Yeah.
you also have to be careful about patient privacy, like I pay A,
Right.
and definitely, absolutely avoid trash talking the patient or caregiver. That's a huge red flag.
Oh, for sure.
Instead, show you understood why they were upset. Show empathy. And importantly, if you made a mistake, because we all do own it, see what you did to fix it.
Okay, so own mistakes, show empathy.
Exactly. For instance, think about a nurse whose patient's family member was really worried about a new wound care order.
Right.
The nurse didn't just say doctor's orders.
Right.
No, they first acknowledged the concern, listened, then explained the treatment step by step in simple terms. They even apologized that the new orders hadn't been communicated earlier, taking ownership of that gap.
Oh, taking responsibility.
Yes,
Yeah.
and offered more help.
Well,
That shows de-escalation, accountability, great communication, all key nursing skills.
that's a perfect example. Okay, building on communication. Another big one is, how do you explain medical stuff, meds, treatments, conditions, without using a ton of jargon?
This is your chance to really show off your therapeutic communication skills, your teaching ability.
Hmm.
It's not just about swapping a medical term for a simpler one like edema for swelling or hypertension for high blood pressure.
Okay, it's more than just definitions.
Way more. It's about gauging the patient's understanding, their health literacy, and adapting your whole style. A great answer might describe how you simplify things, maybe using analogies. But the real gem is mentioning a technique like asking the patient to repeat the information back in their own words. Tell me what you heard, basically.
Oh, I like that, the teach-back method.
Exactly. It confirms they actually understood it, reinforces it, and catches misunderstandings early. Shows you're a real patient educator, not just giving information.
That's super effective. Okay, let's clip to the positive side. What about describe a time a patient was really happy with your care? Or maybe a time you went above and beyond?
This is your moment to shine. Showcase your impact. Think about a specific situation and the outcome. Did you go the extra mile? What difference did it make?
So focus on the result?
Definitely. There was a great example of a nurse with a patient who kept getting readmitted for heart failure, CHF. The nurse realized through just listening and observing that the patient didn't really grasp the new diagnosis or the crucial diet changes.
Okay.
So this nurse took the initiative, explained fluid limits, the no added salt diet, wrote things down, gave concrete food examples, even got the doctor to order a dietary consult,
Wow, very thorough.
and suggested home health care for discharge support. The result.
Months later, a thank you card from the patient saying no readmission since they left the hospital.
That's fantastic.
That's not just being nice. It's proactive, holistic care with a measurable, positive outcome. That's powerful in an interview. 3, excelling in teamwork dynamics.
Okay, moving from direct patient care, teamwork. It's huge in nursing, obviously. You're always part of a team. So how do you describe a situation when you had to work with a difficult coworker? What was the problem? How did you resolve it? Feels like walking on eggshells.
It really can feel that way. It's a big test of professional maturity. And the number one rule, again, is no trash talking. Don't speak badly about anyone.
But keep it professional.
The interviewer isn't just checking if you resolved it, but how you did it. Did you identify the issue quickly? Did you seek a solution proactively? Did you prioritize patient care above the friction?
Okay, focus on the process and patient safety. Exactly. Focus on the problem itself and your constructive approach. Like a nurse dealing with a coworker who always rushed handoffs, leaving out key info.
Yeah, that's dangerous.
Totally.
Yeah.
So the nurse's solution was to come in 10 minutes early, politely mention the issue directly to the coworker, and suggest doing walking rounds together to ensure nothing was missed.
Proactive and collaborative.
Right. The outcome was positive, things improved, and the nurse learned, the importance of speaking up professionally and tackling problems directly. It's about solutions, not blame.
That makes perfect sense. So on the flip side, what about the positive teamwork question? Describe a situation where you displayed teamwork.
Here, you want to show you're not just good at your own job, but you actively contribute to the team's success. Think about a time you helped a colleague who was really swamped and focus on the positive result for them, the unit, and ultimately the patients. A great example was from long-term care.
Nurses there juggle so much.
Oh, I bet. So one nurse saw a colleague having a totally chaotic day, a fall, an admission, a discharge, tons of meds, charting piling up, just drowning.
Yikes.
So the first nurse just jumped in, saw the need, and offered, hey, let me handle that admission paperwork for you, and I can start the discharge forms.
Nice. Just stepping up.
Exactly. The coworker was super grateful, got caught up, finished on time. It shows empathy, proactive support, seeing the bigger picture. That's real teamwork.
It really is about looking out for each other. Now, what about the wider team? Doctors, therapists, others. How do you answer? Are you comfortable communicating with other healthcare team members? Describe a conflict you had with one.
This one lets you showcase communication, sure, but also leadership and patient advocacy, especially under pressure. And again, no putting the other person down.
Keep it objective.
Absolutely. Focus on your actions and the principle behind them. There's a strong example where a patient's wife felt the doctor wasn't really listening or caring about her husband. The nurse listened to the wife's, understood her distress, and then brought those concerns to the physician.
Okay, advocating for the patient's family.
Right. But the physician reacted badly, started yelling at the nurse.
Oh, wow.
Instead of escalating or backing down, the nurse calmly but firmly said the yelling was inappropriate, reiterated the patient's right to have concerns addressed, and stated they wouldn't be yelled at.
Setting boundaries.
Exactly. Even when the doctor reported the nurse, The supervisor backed the nurse up, confirming they acted correctly as a patient advocate. The lesson learned. Address patient concerns, even when it's intimidating, and stand firm for the patient's benefit. 4. Demonstrating adaptability and resilience.
Nursing changes constantly, doesn't it? New tech, new protocols, changing patient needs. Adaptability is just essential. So what about this? What do you do when you don't know an answer to a patient's question or how to address a situation? This must happen all the time.
Oh, absolutely. Every single day, probably multiple times a shift. The key thing here is honesty. No nurse knows everything, and it's totally okay to admit that.
It's okay not to know.
Yes. But what matters is showing you have a safe, systematic way to find the answer. Your response should outline your process. Like, okay, first I'd check our resources, look up the diagnosis or medication, maybe at the start of my shift if it's
Yeah,
unfamiliar.
do your homework.
Then, if I'm still unsure, I'd ask a more senior nurse, the charge nurse, or the provider. For med questions specifically, calling the pharmacist is crucial.
Good point.
And if it's really complex or I'm still stuck, I'd reach out to my supervisor or a specialist. The main message is, my lack of immediate knowledge won't ever compromise patient care. I'll find the right answer quickly and safely.
So it's about resourcefulness and safety, not being a walking encyclopedia.
Okay.
Building on that, how do you handle changes? Changes to your assignment, the unit's routines, the schedule, things getting thrown at you last minute.
Yeah, nursing is full of curveballs. Interviewers want proof you're flexible and proactive when change happens. Share an example where you didn't just cope, but maybe even helped others through it.
Okay, show initiative.
Exactly. Like the example of a facility switching to electronic medical records, EMR. This one nurse picked it up really quickly. But they noticed some of the more experienced older nurses were really struggling with the shift from paper charting.
Yeah.
It was stressful for them.
Yeah, that can be tough.
So this nurse didn't just master it themselves. They volunteered to help those colleagues, spent extra time with them. They even got put on a sort of internal support team to ease the transition for everyone.
That's fantastic. Shows leadership, too.
Right. Adaptability, initiative, supporting your team. Great example.
Definitely. Okay, what about pressure? Describe a time you were under a lot of pressure. How did you handle it?
Pressure. A nurse's constant companion. Everyone feels stress, but nursing is often intensely high pressure. This question is about your coping skills, staying clear-headed, and your problem-solving under duress.
How do you show that?
Well, one detailed example involves a nurse who was both on call and the staff development nurse simultaneously.
Oof, that sounds like a lot.
It was. Pulled in multiple directions, getting calls constantly, needing to go into the facility for urgent issues. It was immense stress. Oops, slipped into Korean thought, correcting back to English. I mean, it was incredibly stressful.
So what did they do?
They implemented proactive solutions. Key thing. They had each outgoing nurse leave a really detailed report, so minor things didn't require an immediate call. They triaged non-urgent issues to tackle the next day. And they started coming in 10 minutes early each day just to organize and prioritize effectively.
Smart, taking control.
Exactly. It shows self-awareness, strategic thinking, and setting boundaries to manage the pressure while keeping patients safe. Other crucial interview questions.
Those behavioral examples are so helpful, but interviews also have those more general but still really important questions, right? The ones that come up almost every time.
Oh, definitely. You can't ignore those. They seem like warm-ups, but they're vital for painting the full picture.
So what are some key ones and quick tips for handling them?
Okay, let's run through a few common ones. Tell me about yourself. Remember, it's not your life story. It's your professional elevator pitch. Keep it brief, positive, honest. Highlight maybe 2-3 key strengths or experiences that directly match this specific job. Tailor it.
Tailor it.
What do you like most least about being a nurse? For most, talk about helping people, making a difference, the challenge, the learning. For least, be honest about the emotional toll, seeing suffering, tough situations, maybe burnout risk, but always pivot back to how the rewards outweigh the difficulties. Shows resilience.
The balance.
Why are you leaving your current position? Stay positive. Focus on seeking new challenges, different ways to use your skills, opportunities for growth that this new role offers. Don't badmouth your old job.
Future focused. Makes sense.
Why do you want to work here?
Yeah.
This needs research. Show genuine interest. Mention specifics, their quality care reputation, the team environment you observe maybe on a tour, specific programs they have. Explain why you fit their mission and culture. Be specific, not just flattering.
Show you did your homework.
Exactly. What are your strengths and weaknesses? For strengths, pick things relevant to nursing.
Yeah.
Connecting with patients, compassion, patience, efficiency may be critical thinking. For weaknesses, choose a real area for growth. Maybe dealing with the emotional side or sometimes taking on too much, but immediately follow up with how you're actively working on improving it. Shows self-awareness and proactivity.
Own it and show growth.
Okay,
Yeah.
why did you choose nursing? Focus on your passion for helping, caring, making a difference. Keep it genuine and centered on others. Most important qualities of a successful nurse? Think. Patience, empathy, desire to help, good communication, staying calm under pressure. List a few key ones.
Core nursing values.
And finally, maybe biggest challenges facing nurses today. Show you understand the field. Talk about increasing demands, the nursing shortage, potential for burnout, compassion fatigue. It shows you're informed about the profession's realities. Outro.
Wow, that's a really fantastic overview of so many key interview situations. It feels like it really comes down to solid preparation mixed with just being authentically yourself. Yeah. Answering honestly, transparently, letting your passion for nursing shine through. That seems to be the core message.
That's exactly it.
Sure.
When you take the time to think through these kinds of questions, to prepare your examples, using something like the STAR method, you can walk into that interview feeling genuinely confident.
Right.
And that confidence lets your real passion, your eagerness, come across. That's what makes a memorable impression.
So for everyone listening, as you think about your own experiences and maybe your next interview, maybe consider, how can you turn your stories, even the tough ones, into powerful examples that showcase who you really are as a nurse?
Start practicing those STAR stories today.
Great advice. Thanks so much for sharing all these insights today. It's been incredibly helpful. If you found this discussion valuable, please make sure to tune in or subscribe to the Interview Mock Lab channel